Today is April 2nd. This is day 2 of our focused and aggressive month of action in April. To reiterate the point that we made yesterday, this really is the month that will set the trajectory and course for our region. As we come together as a community and truly commit to the efforts that have been laid out, we can avoid the devastation we've seen playing out across this nation and across the world, with hospitals being overrun, with patients beyond their capacity to treat them. If we do not in the month of April, then we can expect as a region to encounter similar circumstances and situations. And for all the San Diegans that are in full compliance, and we know there are so many of you who are, we are eternally grateful. Your actions will save lives and help us as a region. For those individuals who are not, as the sheriff just mentioned, now is the time. The time for voluntary compliance is over. Now it is time for strict compliance throughout all communities, throughout all jurisdictions, throughout all areas. And if we come together, in particular, this month of April, we believe we can flatten the curve. We also know our early and aggressive actions on physical distancing, on mass gatherings, on stay at home, proper hygiene. We know that those are making a positive difference. And we know that if we continue to do them and we increase our adherence to them, that we can flatten the curve and we can sustain ourselves through the region. The early days in the outbreak of a pandemic are the days that are most critical, and it can be difficult at times to convey a sense of urgency when you aren't seeing the situations in San Diego like you are seeing in Italy or New York. But the simple reality is when you are seeing those scenes play out in your local jurisdiction, it is too late to do anything about it. And that's why we are pleading with the public for your full commitment and participation. This is the time as a region that we step up. This is not the time that we step back. In the spirit of increased action and focus today, our public health officer is amending several public health orders. Effective midnight on Friday, an order will go into a place that is strongly recommending the public follow the state's guidance on facial coverings. Now, we want to be really clear that we are talking about a facial covering, not a medical mask. If you have a medical grade mask, we ask you to take that to a medical facility or to the County of San Diego so it can be deployed to our frontline healthcare workers. They are the ones who need the medical grade equipment. However, there is some evidence to suggest that a facial covering can help you inadvertently stop the spread and can protect you. But one of the most vital points that we can make to the public as it relates to face coverings is that this is only in addition to everything else that you are already doing. If you are staying at home, if you are leaving your house for an essential purpose only, then when you leave your house for that essential purpose, we encourage and recommend that you have a face covering. But you have to continue physical distancing. You have to continue to wash your hands. In particular, before you put on or take off your mask, it is vitally important that you wash your hands aggressively for 20 full seconds with soap and water. One of the potential downsides of a mask is you're more likely to touch your face. And so as we encourage you to have a facial covering, we encourage you strongly before you put it on or take it off to make sure that you wash your hands. And again, to reiterate the point, a face mask does not stop you from getting it. It may lessen the probability you will transmit it if you are unaware you have it. It may provide some protection from you getting it. But the most effective measures that must be followed first is stay at home, only leave for essential purposes. If you do leave for essential purposes, ensure proper physical distancing and wash your hands. In addition to the strong encouragement for the general public around facial gatherings, we are issuing a mandatory facial covering for all employees of businesses who interact regularly with the public, and we are outlining those to include grocery stores, pharmacies, gas stations, and convenience stores. For these facilities, starting at midnight Friday, your employees who interact with the public must wear a face shield, a face protection, a face covering. Let me be clear, the best way to protect yourself from COVID is to follow the guidance we repeat daily. Wash your hands, practice social distancing, stay at home. But we do believe, consistent with what the state of California issued today and with what other jurisdictions are doing, that there is a benefit and a value to face coverings in addition to all of the measures we should do. So to reiterate, we are recommending to the public, if you leave your home for essential reasons, you should cover your face. And if you are a worker at one of the entities we outlined, grocery stores, pharmacies, gas stations, convenience stores, or the like, you shall have your employees with a face covering effective midnight on Friday. In addition to that order, we are going to require businesses to put in place a social distancing, physical distancing protocol. All essential businesses that are operating today, effective midnight on Monday, must have and make available to the public and provide to your employees your protocols and procedures for how you will ensure physical distancing and hygiene standards in your place of employment. This document must be posted at or near the entrance of the facility. It must also be provided to your employees. As a county, on our website, we will provide some forms, some suggestions, some examples, some recommended type language that you can consider when you use. But it is critical to ensure proper physical distancing for all of our essential businesses that remain open throughout the duration of this crisis. Our next area of public health orders that are being issued today relate to public parks and recreational areas. Those entities must also, if they remain open, post their physical distancing plan. We also will be calling for the closure of all parking lots effective midnight Friday for parks and recreations throughout all jurisdictions in San Diego County. Again, the initial order remains in effect, which is each jurisdiction can decide on their own to open or close their parks and recreational facilities. However, if they are open, they must ensure and be able to ensure physical distancing is met. If they cannot ensure that, then they shall close. The reality is, as some jurisdictions have remained open, we've seen an inordinate amount of folks from other areas go to those jurisdictions, making it more challenging to ensure physical distancing. And by closing the parking lots, we can ensure that local folks who can walk or get there easily can still maintain them, but they do not become a large-scale gathering place for our region. And so all parking lots at park and recreational facilities throughout San Diego County will be closed effective midnight on Friday. We are restricting activities at all of these facilities as well to passive recreation. This is walking, this is hiking. You can do these types of things, but issues like basketball, volleyball, group activities, and those types of active participations will be prohibited throughout San Diego County. And Sheriff Gore just mentioned the enforcement protocol and procedures that his department will be taking and encouraging others to take. Let's jump into the quick number updates and charts. The first chart you will see here, we are reporting an increase of 117 positive cases, which takes us as a region to 966 total cases. Again, even with all of the efforts and actions we're taking, we do expect these numbers to continue to increase. We believe, we know they would be increasing at a much greater rate had we not taken the steps we've taken, and that's why we are still encouraging and requesting the public's not only continued commitment, but increased commitment as we head into the vital days of May. The next chart you will see is the number of tests. You will see a significant spike in the number of tests we are reporting, 2,607, the single largest day. Again, to reiterate the point we make every day, you can't determine a lot on day-to-day test results. These are often batched. They're often reported in large numbers. And so there's no expectation that this is the number we will see every day. This is just simply a reflection of this date and time. But as you can see, the broader trend is our region continues to see an increase in testing, and we continue to work incredibly hard, as do our health system partners who are to be commended. Yesterday we mentioned the story came out that San Diego County had the highest number of tests per capita of any county in California, and that is encouraging news for us, but we continue to seek and look out for more opportunities for testing. The hotel room population here is total, again, public health rooms. We are going to work with our healthcare providers to make sure that they know that these rooms are available for anyone who tests positive, who does not feel confident in their ability to isolate at home or wants to avoid potential exposure to a vulnerable population or to their family members. Those rooms are there and remain available. And we've covered in great depth the last few days the role of the Regional Task Force on Homeless Rooms, and you see an uptick there. Our outreach efforts, our calls to the nurse line continue to increase. Our epi-related calls from our healthcare partners continue to increase. The number of hygiene kits distributed continue to increase. Hand washing stations, we are in the process of installing several that have been requested. The number of toilets distributed declined slightly because they were at one location that was being used for a specific healthcare purpose. That location is no longer needed, and so we have taken those 4 back, and we will site additional public toilets as those requests come in. Next chart here is on ventilators. You'll see a decline in the number. This is not unexpected. We'd said there would be fluctuations on a day-to-day basis. At the time we pulled our reports, a few of the hospital systems that reported yesterday did not get their reports in time. And so again, we will see fluctuations in that number day to day based on the number of hospitals who have reported the daily total available at the time we prepare the report. The number that we have in the county that are ready to deploy has increased. That is consistent with the second line there, those being surfaced, completing their service, being returned to the county and ready to deploy. And we continue to await information or guidance from the state on our request for them. And we continue to await the arrival of the units that we have purchased in the market. Final chart here relates to personal protective equipment. We had a very significant jump from yesterday to today, which is just reflective. Every day we try and gather PPE. Every day we push out whatever we can. You can see in the last 24 hours we've distributed more than 100,000, almost 100,000 more N95 respirators. We've distributed well over 100,000 surgical face masks, quadrupling in the number of face shields, increase in goggles, gowns, jump in the number of gloves, and we are now over 1.3 million individual items of personal protective equipment that has been distributed by the County of San Diego to our healthcare partners, and we continue to do everything we can to provide to them what we believe they need based on our available supply and what we're able to acquire from the state, from the federal government, and through our direct purchase with others. Thank you.